Those waiting at this centre in North India's Kangra district could book a slot to get a COVID-19 vaccine because they had smartphones and knew how to register on the official website called CoWIN. Many others want the vaccine as a second wave of the pandemic ravaged the rural district, but they could not register as they do not have net connections or smartphones.
I have a simple phone. I don't even know how to operate the other phones.
Following criticism that the mandatory online process for those between the ages of 18 and 45 was excluding millions from India's inoculation drive in rural areas, the government has allowed everyone to walk in for appointments. But Manoj Sharma found that the tech-savvy still have the advantage. The numbers of those walking in are limited due to vaccine shortages, while shots are assured for those registering online. That is why Sharma is still desperately asking friends to book an online slot for him.
The government should facilitate this process for us. I am driving all day and providing an essential service.
The technology barrier prompts many to come to this facilitation center for help.
It's a problem because many people in villages are not very educated. Many don't possess smartphones and struggle with the online process.
Even rural residents with smartphones like Vivek Chand find it a challenge to get inoculated due to patchy internet connections. People in nearby towns grab the coveted vaccine slots faster.
अगर registration हो भी जाता है तो उसमें आपका slot नहीं मिलता, time slot जो है.
Even if I register, I can't find a center close by to get a shot. Today, the only place where vaccines were available is miles away. Even those were restricted to those older than 45.
Vaccination लग सकता है.
Such challenges have led to growing demands for administering jabs closer to villages, where 2/3 of Indians live.
हमें ऐसा करना चाहिए कि एक पंचायत में जाके
Centres should be opened in each village for people to get vaccinated. This will remove all the hurdles they are facing.
Health experts say accessing the remote countryside should be a priority as vaccine shortages ease.
If you do not vaccinate them in adequate numbers, there will be a huge reservoir of susceptible persons which the virus or any new variant can attack. And ultimately, when in India's election, we managed to reach the ballot box to the remotest area, including the interior of forests, I think we ought to be able to find ways in which we can actually carry the vaccines there.
That is what these village residents want, an easily available shot to protect them from a third wave that doctors say will arrive. Anjana Pasricha for VOA News, New Delhi.